Members of the jury, I want to confirm while you were away, you did not discuss this case amongst yourselves. You did no investigation and received no information. Is that all correct?
Yes.
Thank you. Mr. Hunter.
Thank you, Your Honor. May it please the court. Morning. We've met before, haven't we, Dr. Washington?
Sorry, sir?
We have met before.
Yes,
haven't
sir.
we? Nice to see you. Let's kind of get a couple things squared away up front if we could. You've been treating the Kowalski family with the exception of Jack for several years, correct?
Yes, sir.
And you agreed to appear here to testify on their behalf, correct?
Yes, sir.
Did you have occasion to meet with Mr. Anderson before you appeared here today?
I did.
Okay. And he had a discussion with you about what your testimony would consist of?
We had some discussion about possible things that would be discussed, yes, sir.
Well, he asked you to review some records for him, correct?
Yes, sir.
And testify about those records.
Yes, sir.
And you are appearing here today as an advocate for the Kowalski family, is that right?
Yes, sir.
Okay. So you're not just a witness, you're an advocate.
Yes, sir.
Let me take you back, if I could, to the first time that you saw Maya Kowalski. That was in 2014.
Yes, sir.
I don't want to belabor this, but she came in at that point to just establish a relationship, a new pediatrician in Florida.
Yes, sir.
All right. And she came in with a diagnosis of asthma, correct?
Yes, sir.
And she had an action plan for the asthma,
Yes, sir.
is that right? Did you ever get her records from her previous physician?
I have a copy of their action plan. Mm-hmm.
Would you ever get her records from a previous physician?
I don't think I had anything from Larry from the Chicago
Okay.
hospital.
Well, you never talked to her previous physician who was transferring care to you, did you?
No, sir, I did not.
Now, just for kind of a baseline here, and for future reference, what was, I've got 1066-1, but the only reason I mention that is to call attention to the weight at that time.
What was the date of that, sir?
That was 11/25, check that, I'm sorry. Yeah,
Okay.
11/25/14.
Yes, sir.
It's 25.3 kilos.
Yes, sir.
Is your math good at that 2.2 times conversion better than mine?
I have it converted someplace, sir.
It's about 64 pounds, isn't it?
Should be. Let's see what I did with that. Well, we can do the math, but. Oh, there it is. So the conversion is 55.7, yes, sir.
Okay. 55.7 pounds.
Pounds. Yes,
And that's as of your first visit with her.
yes, sir.
And then you didn't see her again until September of 2015?
June 19th, 2015.
I'm sorry?
Oh, no, that was my partner. You stand correct. Yes, sir.
So at that time, back in 2015, I think you told counsel that you were still doing hospital
Work.
practice,
Yes,
correct?
sir. Mm-hmm.
And you mentioned something about you were on the medical staff at both hospitals.
Yes, sir.
That would be both Sarasota Memorial and Doctors
No, sir. That would be the two campuses of.
Sarasota Memorial.
Mhm.
Did you have privileges at Doctors?
No, sir.
So were you aware at all of her ER visits and admissions to Doctors Hospital in the summer of 2015?
I don't think I had records of that until she came in to see me in September.
Did you know she had been to Venice Hospital in 2015, in the summer 2015?
I don't have those records, sir, yes, sir.
Okay, well,
But
you
I
weren't
was
aware of
aware,
that.
I was aware that she had been to.
You were, you weren't called in consultation to see her
No,
at
sir.
either doctors or Venice,
No,
correct?
sir.
And when she went to Sarasota Memorial, you weren't called there either, correct?
No, sir.
And were you a part of her admission to All Children's on the 2 or 3 admissions she had in July of 2015?
No, sir.
You weren't involved in that at all?
Yes, sir. Correct.
And you weren't involved in her final admission in July of 2015 at All Children's before she went to Lurie's, correct?
Correct.
Okay. And can we agree but you did get the records from those?
Yes, sir.
And you did see the discharge summaries from those?
Not all of them, but I've seen some of them, sir, I'm sure.
Okay. Well, when you saw this patient in September, she had not just had those several admissions to All Children's, and she had not just had this generalized pain that she's presented to you with. She had also been to Lurie's Children's Hospital, correct?
Yes, sir.
And did you have any records at all from Lurie's?
Not that I recollect, sir.
Did you have any indication from Lurie's of the psychologists and pain management folks who saw her there?
Not at that time that I saw her in September.
Okay. And that was after she was discharged from All Children's, correct?
From the July admission, sir?
Right.
Yes, sir.
And then she went from Lurie's to Tampa General, correct?
Yes, sir, for physical therapy.
Okay, and she was under the care there of a Dr. Kornberg?
I remember seeing the name, yes, sir.
Okay, do you know who Dr. Kornberg is?
No, sir.
You know he's a pediatric
I have no
rehabilitation?
knowledge of Dr. Kornberg.
Have no knowledge of it, okay. Did you know that she saw a psychologist and a psychiatrist at Tampa General?
I was aware.
And you know what her discharge diagnosis from Tampa General was?
I don't have those records in front of me, but I think it was conversion or somatization or something to that effect.
Okay. So when she presented to you on September 2nd, 2015, you had not seen all the discharge summaries from her admissions to All Children's. You had no knowledge of Lurie's, and you had Tampa General's discharge, but you hadn't really read it. Is that a fair characterization?
That's fair.
Okay. And you knew in general that there was a suspicion at Tampa General after a month of hospitalization, or close to it, that there was a somatic syndrome or conversion disorder suspected. You knew that.
I'm aware that that's what they thought.
Okay. So you see her in September 2nd, 2015, what, 2 or 3 weeks after her discharge?
That sounds about right. I don't have that exact
all
timeline
right.
in front of me.
Well, let's ballpark it. Who was she seeing for physical therapy then?
Post Tampa General?
Yes, sir.
I'm not aware.
Do you know how many times she'd been?
No, sir.
Who was she seeing for psychological therapy at that time?
I am unclear whether she was still seeing Eagle's Wings at that time or that was later date, sir.
Well, when you say Eagle's Wings, you're talking about a practice. Do you know who it was she was seeing and what their credentials were?
No, sir.
Okay. The reason I ask is that when you saw her that September, you talk about her stormy course over the summer. She was wheelchair bound, correct?
Yes, sir.
So she was unable to get out of a wheelchair, unable to function, and the history was that the specialists at Tampa General and the specialists at Lurie's were suspecting a conversion disorder, correct?
Yes, sir.
Okay. And you just didn't think that fit?
No, I did not think that fit.
Okay. Well, they had seen the patient for a several-week hospitalization, and then which followed a several day hospitalization. They had done, well, let me just stop there. Did you pick up the phone at that point and talk to any of those doctors and ask, this is your diagnosis, I just don't think it fits. Can we reconcile this? Did you do that?
No, sir.
Did you know that she underwent an EMG study at 10?
Yes, sir, I was aware of that.
Okay. And did you know that she had an MRI?
I know at some point she had an MRI of the brain. Yes, sir.
Okay. So did that figure in your thinking at all?
All data for,
Okay. Now, reference was made to an oxycodone prescription she had at this point.
yes, sir.
Do you know who wrote that prescription as opposed to the one that she got a month and a half before when she was discharged from All Children?
No, sir, I do not know.
Okay. Did you continue that prescription yourself?
I do not believe, I may have written it on one occasion, but I don't believe, I certainly wasn't the one that supplied her on a regular basis.
But you continued the oxycodone prescription that day, did you not, sir?
I'd have to reference my record, sir.
Well, did you know at that point who she was getting that prescription from if it wasn't you?
No, sir, I, unless it was entered in my chart, I did not give it to her.
Okay. Now, with what you knew of what the diagnosis had been or the suspicions had been at Tampa General or Lurie's, did you hear anything about CRPS being suspected?
Not at that time, sir, no.
Did you know that one of the specialists at Lurie's had a special interest in CRPS?
No, sir.
If he objects, you just stop.
The answer stands as given.
Turning, if we could, to your physical examination on September 2nd, 2015.
Oh, yes, sir.
Did you note allodynia?
I did not.
Did you note any skin changes in terms of color?
Not documented in my record, sir.
Did you note any skin lesions in your record?
Not at that time. Did I?
Did you note
Documented.
any change?
Objection. May the witness be allowed to answer the question?
Let's ask the whole question, and Dr. Field, let him ask the question, and then we'll listen to your whole answer.
Okay.
Sorry, I thought I had it, sorry. Did you note any changes in skin temperature?
I did not document that, sir.
Okay. All of those things I've just talked about are potential findings for CRPS, correct?
Yes, sir. I'm aware of that now.
Okay. And to this point in your career, you had never seen CRPS in a child, is that right?
That's correct.
You had seen it in adults,
Mm-hmm.
and you knew what it looked like in adults,
Yes, sir.
but you'd never seen it in a child in 30 some odd years, correct?
Correct.
And you saw no indication of that in the records from Tampa General or all children's that you saw?
Oh, the CRPS, sir?
Yes, sir, of suspicion of CRPS.
No, sir.
Now, on that date, what was the patient's weight?
25.5 kilos again.
No change in close to a year?
Let's see. 3, 15. Yes, sir.
Then you next saw this patient on October 15th.
Yes, sir.
Attorney, if we could, and this was after she saw Dr. Kirkpatrick.
Yes, sir.
Now, you
Yes, sir.
talked to what note allodynia to counsel about
I did not.
what you knew of Dr. Kirkpatrick or didn't know. You never heard of him before, right?
Not documented. Correct. Prior to that.
Did you note any? You thought he was board certified?
Yes, sir.
In your record?
Not at
Where'd you
that
get that
time, but
idea? Did you
I
note any
documented.
change?
I thought that came up in deposition, sir.
Let's ask the whole question.
Is there
Dr.
a
Field, let him ask the question, and then we'll listen.
AMA recognized specialty in CRPS?
No, sir.
Sorry.
Pain management.
Pain management. Document. Did you know whether Dr. Kirkpatrick was board certified in pain management?
I did not document that, sir. Like I said, I assumed he
All
was.
of those things I've just talked about are potential findings for CRPS, correct?
Yes, sir. I'm aware of that now.
I'm sorry.
I thought that I was told that he was board certified,
Never
sir.
seen Who told you that? In child.
I thought the parent. That's correct.
You had seen it in adults. Did they also tell you he was board certified in neurology or something else? You've never seen it in a child in
No,
30
sir.
some odd years, correct?
Correct.
But you thought he was board certified in pain management?
Yes, sir.
Did you think he was board certified in anesthesia? And you saw no
That's part,
indication of that.
basically, you have to be board certified in anesthesia and then have a subspecialty in pain management.
In other words, you have to have an anesthesia in order to get pain management.
Yes, sir.
All right. And you thought he was board certified in both? Now,
That was my impression, sir.
on that date, what was the patient? When you examined this young lady
25.5 kilos again.
on October, well, first of all, let me back up a little bit. By this point, in October of 2015,
Yes, sir.
your patient had already had then you next saw several doses of high-dose ketamine from Dr. Kirkpatrick, is that right?
Yes, sir.
Did you know what the doses were?
Yes, yes, sir.
At that time, did you have any familiarity with the use of ketamine, high-dose ketamine to treat CRPS? You saw Dr. Kirkpatrick?
No, sir. Yes,
Never
sir.
heard of that, had you?
Unclear.
Counsel about, I'm sorry?
Not sure.
What you knew of Dr. Kirkpatrick or didn't? Certainly never had one of your patients suggested to it.
That's correct. Prior to that.
Had you had any of your adult patients treated that way?
Yes, sir. No, my adult patients did not receive IV ketamine. I thought that came up in deposition, sir.
So you don't use ketamine in your practice?
No, sir.
And you never heard of it being used in a child CRPS,
No,
is that
sir.
right?
Up until that point, correct.
Okay. Management. And you never heard Dr. Kirkpatrick?
That's true. He was operating out of Tampa.
You knew who the folks were at All Children's, right?
Like I said, I assume I knew some of the folks at All Children's. I don't know a lot of their staff. Yes, sir.
You know how to contact them, correct?
Yes, sir.
In fact, you still
I
refer to All
thought that I
Children's,
was
don't you?
told that he was. Yes, sir. Certified, sir.
Fairly frequently, correct?
I pick and choose.
Okay. Sent a number of cases up there this year, right? Neurology or something else?
Probably fair to say.
All right.
No, sir.
Point is, you know how to contact Johns Hopkins All Children's Hospital. Is that right?
Mhm.
You know, there's a special line for doctors to call in.
Basically, yes, sir, but that's not how it normally works. Anesthesia and then have a subspecialty.
You know how to contact the doctors. In other words, yeah, I have to have
Yes, sir.
and you got a dial pad on your phone.
Mhm.
Okay. In any event,
And you thought he was board certified in both?
in 2015, when you saw this patient and heard about the ketamine she was getting, heard about this treatment you'd never heard of before,
5 kilos
did
again.
you call Dr. Kirkpatrick?
Well, first of
No,
all,
sir.
let me back up a little. By this point,
You never, have you ever talked to
in
Dr. Kirkpatrick?
October of 2015,
Yes, sir. Not directly that I can recollect, sir.
patient had already had.
So you never picked up the phone and called him and said, what's this treatment that you're giving my patient, is that right?
Yes, sir.
You
No,
know
sir.
what the doses were?
No, sir.
So when you saw her that day, in October of 2015,
High dose ketamine to treat CRPS.
what did you find on a physical examination?
Well, physical exam was pretty unremarkable, other than, couldn't be examined to touch,
Had you had any of your adult patients? You didn't want to be touched.
No, my
Hypersensitive?
adult patients did not receive.
That's a new finding, right?
I thought that came up in deposition, too.
So you don't use ketamine in your.
Correct?
Correct, no, sir.
Okay. So you didn't dope that,
No.
Never heard.
Previous
of it
month.
being Used
correct?
in a child
Yes, sir.
CRPS.
Okay.
Is that right?
So after the first
Up
round of
until that point,
ketamine,
correct.
she's got a new finding that
Never
makes
heard Dr. Kirkpatrick.
examination of her more difficult,
That's true.
right?
He was operating out of Tampa. That's my
You knew
understanding,
who
sir.
the folks were at All Children's, right?
And on that particular day, when you did your physical examination,
You know how.
did
to
you
contact
find
them,
any
correct?
indication
In fact, you
of
still
skin
do.
lesions?
There's nothing documented.
Fairly
there, sir.
frequently, correct? Well,
I pick and choose.
given the diagnosis, that would be significant, wouldn't it? Sent a number of cases up
Again,
there
the
this
skin
year.
lesions aren't used for criteria for diagnosed CRPS, sir.
But they're significant to the diagnosis,
The
correct?
point is, you know how to contact.
That's not what I would use to
Johns
make the
Hopkins All
diagnosis,
Children's
sir.
Hospital, board certified
It's
in
one of a
both.
constellation of symptoms you
Special
might
line
consider,
for Dr.
correct?
Kirkpatrick.
Correct.
Okay.
Yes, sir.
So
but
if you're
that's not how
considering
I would-
making a diagnosis
You know how to contact.
of
them.
CRPS,
Yes, sir.
and you find skin lesions, that's a significant finding, isn't it? In any event,
I disagree. It's
In
not part of the criteria used to
2015,
diagnose that.
but it's
something,
consistent with the disease,
Saw
right?
this patient and heard about the ketamine she was getting.
you can
heard about
have
this
skin
young
lesions
lady
for
you've never
different
heard of
causes. We
before.
already established they're
You
non-specific.
called Dr.
Okay.
Kirkpatrick. Well, first
So
of
you
all,
couldn't tell.
let me back up.
Well, back up, I'll cover that in a minute.
Have you ever?
Let's
talked
do
to
this.
Dr.
Let's talk about changes in skin temperature. Did you find that
Correctly, that I can
on
recollect.
October 5th,
Already had.
excuse me, October 15th,
So
2015?
you never picked up the phone and called
No,
them
sir.
and
I was
said,
already
"What's this
in
treatment
agreement with
that you're
the
giving my patient?"
diagnosis from Dr. Kirkpatrick and was not
So when
perform
you
that
saw
kind of
her
exam
that
on her.
day,
Used
so you just
October
accepted his
2015.
diagnosis?
High-dose ketamine.
It fit, she met the criteria
did you
based
find
on
on
his
the physical
description and his notes.
So you had his notes?
I did have them. Well, physical
sorry?
exam was
Yes,
pretty
sir.
unremarkable,
That's my
other than,
recollection.
couldn't be examined.
Your recollection?
Yes, sir.
Have you had any of your
Did you
adult
see his
patients
video?
who want to be touched?
Not at that time, no, sir.
Hypersensitive?
Adult patients did not receive.
Have you ever seen a video of his first visit with this young lady?
No, I had not.
Ketamine in your.
Correct?
Correct, no, sir.
Okay. You didn't dope that. At that time,
Previous month.
what medications was this
Correct?
young lady on? Okay. So
We're talking
after
October
the
15th,
first
sir?
round of ketamine, she's got a new finding.
She was on albuterol, which is a
Examination
bronchial
of her more-
dilator for her asthma, baclofen, which is a type of muscle relaxant, clonidine, which can be used for pain relief. She's on diazepam, which is Valium, which is a tranquilizer. She had access to an EpiPen, which is an epinephrine if needed in a severe asthma attack or allergic response. She was on Flonase, which is a nasal steroid, fluoxetine, which is antidepressant, melatonin to help her sleep, Miralax, bronchodilators, more asthma meds, and an acid blocker.
How many medications was she on?
Looks like 11, 12. Some of them are as-needed medicines. They're not given
Oh.
regularly.
Now, you refilled her oxycodone at that point, correct?
On that one occasion, yes, sir.
All right. And did you have any idea how long that was going to go on?
No, sir, but I wasn't, that was a one-off sort of thing. That normally she would be getting her meds from pain management.
Did you know that pain management, that Dr. Kirkpatrick expected you to do it?
No, there was no communication to that effect.
Um,
And that would be not following with the protocols for pain management. They tend to like to handle that.
Okay. You noted that she had been to All Children's for acute abdominal pain, correct?
There was so many, let's see here. You talking that specific note?
I'm sorry, I've gotten ahead of myself here. That's the next note. We'll come back to that.
Okay.
Okay. So you renewed her prescription for oxycodone and said you'd see her in 2 or 3 months. Is that
Yes,
right?
sir. Mm-hmm.
So you next saw her, as counsel indicated, on November 5th,
Yes, sir.
and that's, about 3 weeks later?
Yes, sir.
And at that point, she had been to All Children's
Yes, sir.
with what proved to be obstipation.
Mm-hmm.
Would you tell the jury what obstipation is?
I believe we discussed it, but it's basically a severe form of constipation.
That can be caused by narcotics and oxycodone?
Can be caused by medication use, yes, sir.
Can it be caused by oxycodone?
Absolutely.
Okay. At that point, there was a conversion being made to put this young lady on a dilaudid an IV dilaudid patient-controlled anesthesia device, correct?
Yes, sir.
Did you discuss that with Dr. Kirkpatrick?
No, sir.
That's a situation where there's an indwelling IV line.
Yes, sir.
That's a PICC line,
Mm-hmm.
correct?
Yes, sir.
Incidentally, do you ever order PICC lines to be placed?
Order PICC lines on people getting long-term IV antibiotics, yes, sir.
And when you do that, do you expect the person placing the PICC line to endorse or second guess your diagnosis and your treatment?
No, sir.
They're just a technician, right?
Well, you place the order for the PICC line, yes, sir.
And you expect them to put it in and not question why it's being put there.
Normally.
Okay. Now, the Dilaudid is a synthetic form of narcotic, correct?
Yes, sir.
And that also has a number of potential issues with it, doesn't it?
Yes, sir.
Did you know how long that was going to go on?
No, sir.
Did you ever discuss with Dr. Kirkpatrick how long that narcotic was going to be given to your patient?
No, sir. He is the person controlling the pain management routine.
Okay. Now, you did know at this point that the patient was planning to go to Mexico for a ketamine coma. Is that right?
Yeah, I believe that was the... I'm not sure if I knew that date or not, sir.
Let me ask you to have reference, please, sir, to your note regarding your first visit with Mrs. Kowalski of that same day.
Okay.
I think you'll find in there that there's some discussion of
Okay.
going to Mexico. Okay. Did you have any idea what the coma would consist of in terms of how much ketamine the patient would be given or how long she would be in a coma?
I understood it was to be 5 days, but the dosing was not discussed.
Had you ever heard of that being done before?
Again, we were on new grounds there with, complex regional pain syndrome, and so I don't have extensive background for people having received it.
I'm sorry?
I didn't have a large pool of patients to draw experience from for that, sir. It's an unusual condition.
Okay. Well, let's talk a little bit more about that as long as you made reference to it. It's an unusual condition in adults, correct?
Yes, sir. It's an uncommon condition in adults.
Uncommon. But it's rare in children, correct?
More rare, yes, sir.
Okay. So rare you'd never seen it before.
Correct. Not in children.
And sufficiently rare, had you ever seen it presenting as a generalized pain syndrome?
Have I ever seen it? No,
Yes,
sir.
sir.
No, sir.
All right. Because usually it's regional, right? Name implies.
Me-
Chronic regional pain syndrome.
More common in adults to be regional. Okay.
So you were dealing with a doctor you'd never heard of, a disease that you'd never seen before in this setting, and two sets of treatment. The initial ketamine treatment by Dr. Kirkpatrick and now this coma. Two sets of treatment that you'd never heard of before. Is that right?
That sounds accurate.
And you had no discussion with Dr. Kirkpatrick about any of this?
No, sir.
When you saw her on the 5th, had her condition changed? Was she still wheelchair bound?
Yes, sir.
She was still non-functional?
Yes, she's still having this severe extremity pain.
And so she was still unable to go to school?
That's my understanding.
Now, at that point, you basically just kind of let Dr. Kirkpatrick drive the ship, so to speak. Is that right?
Yes, sir.
Okay. And you didn't provide him with any input at all, correct?
Correct.
And you never tried to reconcile his diagnosis with that of the other specialists who had seen this patient, right?
No, I think that when you looked at his criteria, it fit the best of existing explanations. The chronic regional pain syndrome fit her better than anything else.
Okay. So you then next saw her on December 17th,
Yes, sir.
after she'd come back to Mexico, from Mexico,
Yes,
right?
sir.
She's still in a wheelchair?
Yes, sir.
She's still not functional.
She could be. I made a note that she could be touched and examined more readily than previously.
But in terms of function, ability to go
She
to
was
school,
still in a wheelchair.
she couldn't walk. She's still in a wheelchair.
Yes, sir.
She's still non-functional. Correct?
But improved.
Improved. And that improved meant her pain wasn't as bad.
Yes, sir.
Didn't go away, it just wasn't as bad.
Yes, sir.
Now, at that point, she's about to go back to Mexico again. Is that right?
Yes, sir.
And she's anemic,
Yes, sir.
and she's actually lost some weight
A little bit.
previously.
Yes, sir.
Did you know whether she was getting any physical therapy at this point?
I know there was ongoing attempts to give her physical therapy, but sometimes if she couldn't be touched, it's hard to achieve if she can't tolerate being touched.
Let me ask you this. Did you ever talk to her physical therapist?
No, sir.
Did you even know where she was getting physical therapy?
I think there was different places at different times, sir, so I'm not aware at that particular moment.
Okay. Were you under the impression that she was still getting psychological therapy?
I don't make a comment on that, sir.
So you didn't know one way or the other?
Yes, sir.
And have you ever spoken with any of her psychological counselors or mental health counselors?
At any point in time or at this point in time, sir?
At that point in time?
At that point in time, no.
So and you didn't know who they were,
No,
if
sir.
any?
No, I'm confident she was seeing somebody.
But you don't know who?
Discussions with the parents, mm-hmm,
You don't know who, and you don't know under what circumstances?
correct.
So you saw her for a illness visit in February. Is that right?
Correct.
And then you also saw her, as counsel and you have discussed, in April of 2016, April 1st, 2016.
Yes, sir.
At that point, did you know who was treating her with ketamine?
I'm trying to think whether it was Dr. Hanna or Dr. Kirkpatrick at that time. I'll have to go back and look.
Okay. Well, did you know how often, I mean, you make reference to multiple ketamine treatments. I think you say 3 to 5 times a week for the entire month of March.
Mm-hmm. Yes, sir.
Did you know what the doses were?
No, sir.
Did you know why it was she was receiving that much?
Because that was what was felt was helping her.
Well, then let's talk about that for a minute. Was she still in a wheelchair?
Don't comment on it at that particular time.
Did you think she had gotten out of the wheelchair?
No, sir.
So is your recollection she was still confined to a wheelchair?
That's my recollection.
And she's still non-functional? She can't walk?
Okay. You're being generalized and saying
Okay.
non-functional.
Well, is she back in school?
She's still homeschooled.
Does she have pain in her upper as well as her lower extremities, or did you note that?
In that visit, I did not necessarily note that.
Did you note any complaints of lack of sensation or weakness at that point, other than recalling that she was still wheelchair bound?
No, nothing else is documented, sir.
So, at that point, well, let me back up. Did you note at that time any allodonia or dystonia with this patient?
The fact that I didn't comment at all on her neurologic exam means that she wasn't tolerating my touching her.
And by this point, can you just tell us how many medications she had gotten up to?
See it in my notes, sir. I'm sure you know the number.
To tell you the truth, I want to make sure of my count.
Sorry?
I want to make sure of my count.
All right, well, we can do that. And a lot of these there's some vitamin supplements in there. There's some what we call PRNs, which is as needed. So we can do the count. 1, 2, 3, 4, 5, 6, 7. 19 or 20.
More.
Yeah.
Then you have a gap in your treatment of this patient between that date, April 1st, and August 11th of 2016. Is that right?
Yes, sir.
You didn't see her at all between those two points, right?
That's correct, sir.
Were you aware she was getting hyperbaric oxygen therapy?
I was aware.
How were you aware of that?
Beyond had told me.
Is that something you recommend for CRPS?
Let's diverge for hyperbaric treatment, okay? Number one, I'm very comfortable with hyperbaric treatment because I used to work as an attendant and an operator for hyperbaric treatment when I was a medical student at UF, all right? So I'm familiar with the different applications of hyperbaric therapy. And so I was very comfortable with hyperbaric therapy. There had actually been a paper for CRPS utilizing hyperbaric treatment. So I understood the parents wanted to try something different, something to try and help her.
Were you aware of any recommendation that CRPS patients try hyperbaric therapy?
I know that they had found that through their investigations online.
Did you refer her for that?
No, sir.
while I'm on the subject, did you ever refer her for any psychological therapy?
It was my impression that she was under therapy at the time she needed it. At no point did I see that she was crashing and burning and wasn't already established with a counselor.
So back in the fall of 2015, if I can back up just a minute.
Okay.
When Dr. Kirkpatrick first saw her in September and October, you were never aware of any situation in which she was becoming suicidal or mentioned being suicidal?
It was never mentioned to me, sir.
All right. Did you ever see that in Dr. Kirkpatrick's records?
Objection, Your Honor, beyond scope.
Don't recollect that, sir.
All right. Let's go back to August of 2016. Was she, let me back up one more moment on the referral. Did you ever refer her for immunodeficiency?
No, sir. She was already seeing allergy immunologists.
You know who that was?
She saw several.
Did you see Dr. Menendez?
That was one of them.
Did you refer to him?
No, sir.
Did you ever see the report that he sent you?
Yes, sir.
You saw it just before your deposition was taken in this case, is that
I
right?
saw it at some point before that.
Well, did you ever call him and
No,
ask
sir.
about any of his impressions or the potential for Munchausen by proxy?
Objection.
I saw the note, sir, but I didn't.
Hold on a second, what's the legal basis?
It states facts, assumes it states facts not in evidence, the records are not in evidence.
Overruled.
Subject,
I saw the comment, but I did not believe it applied to Maya.
so you never talked to him about it?
No, sir.
And you saw that he did not diagnose an immunodeficiency?
I saw several other allergy notes that did document IG subclass deficiency in Maya. Okay, that I've seen laboratories, and I saw notes from, I think Dr. Tan was one, and there was perhaps another who did document her IG subclass deficiency.
Well, did you ever refer her to any of those doctors?
No, sir.
Did you ever talk to any of those doctors about how to proceed with her care?
About what, sir?
How to proceed with her care?
No, sir.
All right. So when you saw her in August of 2016, was she still wheelchair bound?
She's been doing pool therapy, and she was still in the wheelchair. Mm-hmm.
And she was still complaining of generalized pain, correct?
Correct?
And if I could ask for Joint Exhibit 1073, page 75, to be put up. Council asked you about your medical referral for homebound learning.
Yes, sir.
It was filled out at or about this time, is that right?
Yes, sir.
And let me ask you to look at it with me here. You answer yes. Let me scroll on down. You answer yes to the question of whether the student is suspected to be absent from school due to a physical or psychiatric condition or for at least 15 consecutive school days or 8 on a block schedule. You answered yes.
Yes, sir.
And then we skip down some, and it asks, that was a nice increase in size there. It asks at the bottom, is the student confined to home or hospital and full-time homebound or hospitalized? And you answered yes.
Yes, sir. I was trying to do what was in Maya's best interest.
Well, you believe that to be accurate, correct?
More or less.
Well, you weren't telling the school board a lie, were you?
No, sir.
And then says, do you recommend the student be placed in the most restrictive environment? And you said yes. Is that correct?
I wanted her to qualify for hospital homebound, sir, so that she could pursue her treatments and get her therapy.
And you certified under yes, number 5, that is the student under medical care for illness or injury which is acute, catastrophic, or chronic in nature.
Chronic in nature.
So, at that time, she had gained weight, correct?
Yes, sir.
When you were asked to comment on her weight at all children's, did you compare her weights in the hospital or just those at admission and discharge?
No, sir, I didn't have the linear weights done in the hospital. I just had my records.
Okay, so you never saw the indication in the chart that she got up to close to 70 pounds at one point?
You're talking about controlled and uncontrolled circumstances. I don't know if they're using different scales. I don't know if they're weighing her clothes, what situation. In my office, we weigh her on the same scales in the same circumstance. So I put more trust in my weights than what's done in the hospital.
Yours are closed, correct?
Sorry, yes, sir.
But the answer is you never looked at how the hospital weight changed during the admission.
Yes, sir.
Incidentally, when you were seeing this patient, did you ever consider the diagnosis of a tethered spine?
No, sir.
Ever enter your mind?
No, sir.
You saw this patient after she was discharged from All Children's.
Yes, sir.
You told us what your impression of her condition was at that time.
Yes, sir.
First exam is January 18th of 2017. It's 10/66/17.
That's correct.
And she's up to 29.3 kilos, correct?
Yes, sir.
That's 4 days after her discharge?
Yes, sir.
And you've described your impression of what her condition was at that time. But it makes reference in your note to following up with psychology and physical therapy.
Yes, sir.
Did you talk to her psychologist or a physical therapist at that point?
Number one, we don't routinely contact the physical therapists. I mean, usually if they have an issue, they send us notes or requests. So
Did you
no, I
write her
did
a
not.
script?
Yes, sir.
You wrote her a script.
I don't know if she already had a script for physical therapy at that time or if we wrote it.
Do you
If
know
they
how many
requested
times-
one, I would have given one.
Sorry. Do you know how many times she went?
No, sir.
You didn't follow up on that at all?
No, sir.
Okay. And you didn't know who she was seeing for psychological therapy?
No, sir.
Now, if we fast forward here to the following fall, September of 2017,
Okay.
was she improving?
Yes, sir. I made the comment that she was doing markedly better and able to get out of her wheelchair.
And at that point, how long had it been since she had any ketamine?
Since prior to going to the hospital. Well, no, she got some in the hospital,
She
actually.
got some at the beginning of the
Yeah,
hospital.
Yeah,
And you
that
don't
would have
know
been
what-
October.
You don't know what dose that was,
No, I don't.
and you don't know how that dose compared to what she was getting from.
I know it was
Dr.
less than what she was getting from pain management, yes, sir.
Substantially less.
I don't know. Substantially, I know it was less because
Okay.
Beata was requesting more.
At the time you saw her in September of 2017, what analgesia was she getting, if any?
At that time, there's no prescription analgesics that I see on my records.
As a matter of fact, she's down to 3 medications on your record, is that right?
Correct?
And she's not taking clonidine or opiate or anything like that, correct?
That's correct.
And did she then continue to improve after that?
The next time I saw her was January of 2018.
And she had made huge strides,
Mm-hmm.
is that correct?
Yes, sir.
And she kept improving from that point, is that right?
To a point.
To a point. And then she had a hospitalization in Orlando, correct?
Correct.
Did you ever talk to the doctors over there?
I talked to Dr. Bornstein.
Okay. And his impression was of an eating disorder?
No, sir. It was not.
What was it?
He distinctly did not make the diagnosis of an eating disorder, okay? And basically, his endoscopy showed limited gastritis, and he felt, my impression was that this was stress-induced and that she had limited this was a response to her stress at the time.
He didn't indicate to you that he thought there was a restrictive eating disorder secondary to stress and anxiety?
Restrictive eating disorder means that you're not taking in the calories, okay, and you're doing that because she was having abdominal complaints. That is not the typical eating disorder that I see in young females. The typical eating disorder I see in young females, they have disturbed body image. They think they look good. They don't see anything wrong with them, and they're extremely difficult to treat.
With bulimia and that sort?
That's one aspect of it, yes, sir.
And she's never had that?
No, sir.
But she's continued to do well since then, after that?
She got better, fortunately.
Okay. And today, is she doing better still?
She's obviously under a lot of stressors. Stressors make everything worse. So I think the jury's out on that, no pun intended.
Well, she's been, what, 6 years without ketamine?
Yes, sir.
And you know of no plans for her to get more?
None has been discussed with me, sir. I don't see an indication for it at this point.
Talked about what went on when she was admitted to All Children's. Were you told about the court proceeding that was going on?
At some point, I was told that there was motions made to try and get visitation for the parents.
Did you offer to help with that?
I did.
Did you ever, after you talked to this resident that you spoke of, did you ever call All Children back?
No, I didn't.
You know the attending physicians there, you refer to them, correct?
Yes, sir.
Did you ever pick up the phone call?
I did not know any of the physicians that were on the service taking care of Maya. I had previous experience with the child protection team, which included Sally Smith.
I'm not asking
Okay.
about the child protection team.
All right.
I'm talking about the doctors at the hospital.
No, sir.
You refer up there, you know how to get in touch with the All Children's Hospital, right?
I do.
Your phone's got a dial pad, correct?
Correct.
Did you ever call them?
No.
Thank you.
Mr. Anderson?
Insofar as not being able to use ketamine, patients before anesthetics manage to get over their illnesses, didn't they?
Yes, sir.
And the pain meds are not designed, if I understand your testimony, to be a cure. They are to make things better.
Objection, leading your honor. Overruled. That's my understanding.
So whether or not Maya had ketamine and could get through that easier and faster, she had to go through this without ketamine and just grit it out.
Yes, sir.
Have we,
Hold on a second. What's the legal
Leading
basis?
compound, that's,
Sustained.
from what you saw, was it more difficult for Maya to try to stabilize and get better without the ketamine?
Without ketamine?
Yes. Was it, did she need the ketamine to get better quicker from what you saw?
It might have been helpful in that circumstance when she had the second presumed episode.
Meaning she had another episode, another relapse after she got out of Johns Hopkins?
Leading your honor.
Overruled.
That is my impression.
Now, getting to the number of meds, let's pull up what's been marked in evidence as 2002. I'll show you what is in your file, I believe. Well, actually, I know it is. And if we can go, is it the next one here with the number? All right. So this is the discharge summary from Johns Hopkins as of January 13th, 2017. So I want to go over what Johns Hopkins had her on or recommended. You see here where it says home medications and new prescriptions?
Yes, sir.
All right, so is Aquaphor a topic that can be used for skin lesions?
Yes, sir.
What is lansoprazole?
It's an acid blocker.
All right, next.
Let's scroll
Hang
the
on,
page.
can we?
Okay, here we go.
Page. All right, so the next
Acetaminophen, pain reliever. Albuterol is a bronchodilator for asthma. Baclofen is a muscle relaxant. Cetirizine is an antihistamine.
okay, and what's the,
Cholecalciferol is vitamin D.
okay,
Ferrous sulfate is an iron supplement. Fluticasone is a nasal steroid. Oh, in that case, that was an inhaled steroid. The fluticasone nasal was a nasal steroid inhaled,
okay,
sprayed through your nose.
all right, and we have another one, this is the last page.
Mupirocin is a topical antibiotic. Polyethylene glycol is Miralax for constipation. Pregabalin is Lyrica, which is used in pain management. And multivitamins.
So, was Maya Kowalski discharged from Johns Hopkins with only 3 medications or with 13 or 14, depending on whether you see a vitamin as a medication?
On the list there's 14.
And was she checked out with a pain med or medicines designed to combat her CRPS pain?
That was the pregabalin, which is Lyrica.
How about the baclofen?
Baclofen would also be used for that.
The following hospitals and doctors were cited on your cross-examination about why you didn't call them back. And there was Doctors Hospital, Venice Hospital, Tampa General, Lurie, and I think another doctor. To the best of your knowledge, none of those doctors were accusing the Kowalskis of Munchausen by proxy, were they?
objection.
Sustained.
That's to my knowledge, yes, sir.
Sir, the jury will disregard that answer.
To the best of your knowledge, there was no reason for you to need to call them back.
Correct.
And Beata Kowalski was, in fact, reporting back to you the next visit on what was going on.
Yes, sir.
Did she give a thorough history to you about the events in Maya's medical life, lack of a better term, since the last time you saw her?
She brought me up to speed on what was happening at that time.
thus, was there any need for you to call physicians once you had the data from Beata Kowalski, the infusion nurse?
Objection, leading.
Overruled.
The Beata was an extremely good historian, very knowledgeable medically, and they were very good about communicating to me what was happening with her and what the plans were and what they were hoping for.
And do you recall, as to the school homebound, whether that issue of whether she was going to go back to school in a wheelchair as opposed to staying in homebound at home, that were you aware that that was denied, that she was forced to go to school rather, in other words, that what you wrote down didn't work effectively?
I thought, number one, I knew she didn't want to go to school in a wheelchair, and I thought it was not in her best interest to go back to school and be stressed and upset when we've had this track record of having great difficulties when the stress levels go up. I was aware, which was the first time I've ever had them decline an application for hospital homebound. I still to this day don't know why they declined it, but I've never had that happen before.
And did it come to your attention that this emotional issue by Maya to having to go back to school, in fact, precipitated another relapse?
And she was upset, yes, sir.
Nothing further, Your Honor.
Anything further? Defense? Members of the jury, do any of you have a question for Dr. Wassenhauer? Can the attorneys come forward? Were there any other questions, or just the ones that were presented? Okay. Okay, Doctor, who made the note of Kyle appearing malnourished, and who had he been examined by to reach that opinion and notation of record?
Is this in reference to Kyle?
Kyle, yes.
I'm not sure who made that reference.
Thank you. The next question from the jury, is it common for doctors to collaborate with other doctors about their patients' care?
In a perfect world, it would be very nice. It is easier when you are part of the same system, such as my current group. We have we have a wide spectrum of specialists. We share the same medical record. So communication there is much easier because we can look on there and tell what's been done, what's been ordered. We can see the labs. Unfortunately, in the real world, when we are utilizing outside specialists and outside physicians and tests, it is very difficult for us to we don't always get comprehensive records. There is problems with communication sometimes, and it is, we can request records. I'd say half the time we get it, half the time we don't. So if there is when we communicate currently most often directly is usually when I'm trying to get someone seen on an urgent basis to address a medical problem, because the current logistics, it'll take way too long for them to get in there and be seen by the specialist. So the most common scenario in which I pick up the phone and call someone is when I'm trying to get somebody seen urgently for an urgent medical condition.
Plaintiffs, any follow-up questions?
No, Your Honor.
Jurors, any follow-up questions? Okay, and may Dr. Wassenaar be excused?
Yes, Your Honor, please.
Thank you.
Okay. Thank you, Dr. Wassenaar, for being here.
Thank you very much.
Judge, we're not sure we're going to release him yet, but he may be.
Okay, so to the extent you're under a subpoena, it's possible you might have to be called back
Today or another day or what?
another day.
Okay.
I'm assuming it's another day.
Probably not, but.
Okay, no, that's fine. I'm just wanting to know whether to hang around or not.
No, you don't need to hang around today.
Thank you.
Thank you. I'm looking for timing based on the witnesses you have this afternoon. Is there a short witness or?
I mean, relatively, our next witness would probably be 20 to 30 minutes on direct, and I'm gonna guess 5 to 10 on cross, but
Given the other witnesses you have this afternoon, should we take a lunch now or?
I'll leave that to the jury.
I'm asking you, given the scheduling that you have.
All of our witnesses are here and can be here for the duration of the day.
Are you all okay to go another, sounds like 30 minutes, or do you want to take a lunch now? Okay, I'm hearing, let's call your next witness.
All right, plaintiffs call Linda Brown.
Do you solemnly swear or affirm testimony you're about to give will be the truth, the whole truth, nothing but the truth?
Yes, ma'am.
So you're gonna go walk around and have a seat on that witness stand?
Good morning, just barely. Would you please state your full name for the record?
Linda Suzanne Martin, hyphenated Brown.
And you and I have spoken on a couple of occasions, but we've never met in person, have we?
Not till today, sir.
Have you been called here to testify as a member of Epiphany Church?
Not really
Are
sure.
you a member of Epiphany
Yes,
Church?
I am.
Are you also a member of the Legion of Mary?
I am.
And on occasion in 2015 and 2016, did you come to know the Kowalski family?
For whatever their needs might be. They also have what they call a traveling Mary or a pilgrim Mary. She's about 3 feet tall. And she comes in a big kind of black box, almost looks like a golf club kind of bag, but it's all square. You know, it's long and rectangular. And she comes in the box, and she has a beautiful crown that we put on her head, and there's a ceremony that goes with it, with a book that's inside of this box, all contained with Mary. We put rosaries around her neck, and then we pray with the family. We engage them with certain prayers that are in this book to leave the Mary with them, so that they continue to do the rosary with this pilgrim Mary who's present in their home. And she's there for healing and hope and health, and gives a lot of us Catholics a whole lot of hope.
You happen to live in Stonewalk, which is the Kowalski's neighborhood, right?
It is.
And did there come a time in 2015 when you learned that Maya had a pain condition of some sort?
Was it 2015? Gosh, it was that long ago. From Sister Francis, I was at church with Sister Francis. I used to went to daily mass when they had it then. And excuse me, I don't mean to go on.
You're doing fine.
Yes, I just need to breathe. Sister Francis was speaking to someone about saying prayers for the Kowalskis. And she saw me and said, "They live in your neighborhood." And I said, "Oh, I will bring them the traveling Mary," because Sister Francis was telling me that their daughter was ill, and my heart went out to her, so I wanted to bring Mary there so that they all could pray for the healing of their daughter.
And so did you take the Mother Mary to the Kowalski's house?
I did. That was the first time I met Beata, and I went into the home, and her sister was there from Chicago. I did not see Maya at the time, and the husband was there as well, and they were getting ready to go somewhere for some function. So normally when you come into the house with this traveling Mary, you do the whole ceremony with the family and you set her up.
Ma'am, while we wait for the next question, okay?
All right. So you went to the home, you met Beata, you met Jack. Maya, you didn't see her. You brought in the Mother Mary. You explained a little bit, but what is the normal process that you go through with a family when you unbox her and set her up?
We unbox her and put her in a prominent place, and then we put the crown on her head and the rosaries around her neck, and we say the prayers that are in this particular book that comes with. And the family gets books as well, so that they can all look at the prayers so they can say them together.
And on that occasion, you already mentioned that the Kowalski family was on their way out or something. So did you go through the ceremony with them at their house, or did you leave Mother Mary and trust that they would do that?
I left Mary with them to trust that they would do that.
And then how long does Mother Mary typically stay in a family's home or a sick parishioner's home after you deliver her?
A week, or if she's not in need for someone else, if they need her longer, it can be extended. So the duration is who needs her next and who's waiting for her, or who needs her the most at the moment.
Did Beata and Jack appear appreciative that you were there with the Mother Mary?
Oh yes, absolutely.
And after a week, Did you pick Mother Mary up or someone else?
No, sir.
Meaning someone else picked her up.
Yes, sir.
Okay. And so that was in 2015, and then fast forward a little bit, sometime in 2016, you saw Maya during the 4th of July parade, is that right?
That is correct.
Can you tell us a little bit about your interaction with the Kowalskis on the 4th of July, 2016?
Well, it was our whole neighborhood, and it was the Kowalski family and a family across the street, and we intertwined. And there was a big, huge slide, and my immediate thing I first went to do was to go see Maya, and I did. She was in her wheelchair, and I gave her a big hug, and I thought she looked so well, I thought that she could just get up out of the wheelchair any day. And I gave her a stick of huckleberry chapstick, and gave her a big hug, and just continued to be at the party. And
So typical 4th of July in your neighborhood with the parade, and you saw Maya that day, is that right?
I did.
And then, is it true that the next time you interacted with the Kowalski family was when you got a phone call from Beata?
That is correct.
What was Beata's mental and emotional state at that point?
She was absolutely distraught.
Could you understand what she was telling you on the phone?
No, I could not, which is why I went over there to speak with her, so I could try to understand what she was saying to me.
And what did you learn when you got to the Kowalski home that day?
That Maya had been taken away from Beata.
And so you resolved to do what you do and deliver the Mother Mary?
Joyce and I were bringing the traveling Mary to Maya.
Let me ask the question.
Yeah, I'm sorry.
It's okay. You show up at the Kowalski home, Beata's distraught. What did you decide to do to help Maya?
I went over to see Beata because she couldn't speak over the phone, and I didn't know what was wrong. And when I got there, she was crying and, snots everywhere and just so upset. And she kept saying that they took her, and I'm like, who took her? And she said the hospital took her, and I didn't understand any of that.
It's a legal basis. Is there an exception, Mr. Marchant?
Excited utterance, then existing mental state.
I'm going to overrule the objection. You can finish your answer.
You were saying the hospital took her, you can continue.
And I didn't understand what she was talking about at all. I didn't understand that. So I was just sitting there with her to just, help her breathe. And then Jack came home, and I left to let the two of them be together.
In the next couple of days or the following week, did you decide to then deliver Mother Mary to Maya?
Yes, we decided that we would go, we would bring her to the traveling Mary to the hospital that Maya was in.
Your Honor, I'm sorry.
Sure. proceed.
Thank you, Your Honor. So we were beginning to discuss your decision to take Mother Mary to Maya. And you said we. Who's we?
Joyce Sacco and myself.
And who is Joyce Sacco? Is she another member of the Legion of Mary?
She is a member of the Legion of Mary.
All right, so you knew at that point that Maya was at Johns Hopkins All Children's Hospital, and you made a drive up there. Can you describe a little bit the drive up there?
I drove with Joyce in her vehicle, and we just prayed the entire way. We didn't discuss anything because we didn't know anything other than we were praying to help a little girl who was sick. That's all we knew.
And you arrive at the hospital, and you get up to Maya's room, and if you could describe the scene as you enter Maya's room.
I went in her room, and she was sitting there crisscross applesauce, and I went over to her, and she reached up to me, and I hugged her, and then we were
And what happened next?
just like darkness was there, and we were told to get out of the room. We weren't supposed to be in there. We I wasn't supposed to be touching Maya, and that what were we bringing? What was that? We tried to explain that it was the miraculous Mother Mary, and that we were bringing her to be with Maya so that she could pray, and they said that was not allowed and that we had to go. So we left the room.
And who's they? Nurses or doctors?
Just whatever that dark force was behind me. I didn't really. It just was dark. That's the only way I can explain it.
And it was explained to them. You mentioned this is the Mother Mary. She's here to pray with Maya. Is that right?
That Maya would pray with her, yes.
And so, did they give you any reason that you couldn't be there with her?
They did not, no, sir.
But they kicked you out of the room immediately?
Yes, sir.
Where did you go?
To the chapel,
What did you do in the chapel?
prayed,
And where was the chapel?
downstairs in the hospital.
And were you praying for Maya?
Yes.
I missed something. Were you allowed to leave the Mother Mary with her in the room there?
No, sir, I was not.
And you weren't allowed to leave the rosary beads that would go with
No,
Mother
sir.
Mary? And you weren't allowed to leave the prayer book?
No, sir.
And you went down to the chapel and prayed afterwards?
Yes, sir.
How long did you stay there?
An hour at least. Maybe more, because other people came in and saw us in there, and they had sick children, and they asked us what we were doing, and we said we were praying, and they came in and prayed with us for their children as well. So it was a whole group of us praying for sick children.
At some point before this incident at the hospital, had you given Maya a rosary or a medal or something like that?
I've probably given them, I pass out miraculous medals, which I carry with me. Where are they? There you are. And she's a miraculous medal, and it has Mary on there, and it's on a chain, so you can wear it. And then there's a card that shows you the miraculous medal. It's a miracle that happened, and it explains, if I may, it's just real short.
Objection, Your Honor.
Okay.
I'm not sure what the question is at this point.
Let's wait for a question.
It's given to
Ma'am,
people
let's-
for,
Ma'am, let's put it down, let's wait for a question.
All right. Is this something that you've given Maya in the past?
yes,
Have you seen Maya recently?
yes.
Does she still have it?
Not aware of that, but I can tell you what she said to me when I gave her a hug.
Please.
Objection, Your Honor. Hearsay.
Stay.
How did you know when you were in the room there that you couldn't leave the Mother Mary statue?
We were told that we had to leave the room and take whatever was in the box out.
I heard your earlier testimony that no reason was given. Did they ever present you with some sort of list of who was allegedly allowed or not allowed in the hospital to see Maya?
No, sir.
The witness.
Ms. Cross?
Thank you. Good afternoon.
Good afternoon.
I love your hat.
Thank you.
I just have a couple questions for
Sure.
you. Before, well, first of all, you, as you said, you live in the neighborhood, same neighborhood as the
Yes.
Kowalskis, correct?
Correct.
All right. And, you talked about the first time you went to the house and you brought Mary, but they had company or they were leaving, so you did not stay and do the whole ritual, correct?
Correct.
All right. And then you had the second time when you went, because Mrs. Kowalski had called you and you went there and she was very upset.
Correct.
All right. And almost incoherent.
I'm sorry?
Almost incoherent.
Yes. I mean, you know, she got it out, but I had to physically be there with her.
Right, understand. And it was after that visit that you went to the hospital, correct?
Correct.
All right. And when you went to the hospital, you don't recall checking in with security
No, ma'am.
or getting a name tag,
No, ma'am.
right? And is it fair to say that you were unaware as to whether or not DCF, the Department of Children and Family Services, was requiring background checks for anybody who would be visiting Maya?
Objection.
Legal basis.
Facts not evidence.
Overruled. You can answer.
That's
Could
not
you
something
repeat
you
the
were aware
question?
of, correct?
I was not aware of any of those facts, ma'am. No.
Right. You had no knowledge as to what restrictions there were or were not with respect to visitors for Maya, correct?
Correct.
All right. Now, you would certainly understand that, well, I'll strike that. When you went to the hospital room, you were only in there briefly, correct?
Seconds.
Seconds. And you indicated that you saw Maya and she was sitting crisscross applesauce on the bed.
Mm-hmm.
She seemed happy to see you.
Mm-hmm.
Yes?
Yes,
Okay. You gave her a big hug.
I did.
She hugged you back.
Yes.
That's right. And then you were told that you had to leave, correct?
Correct.
All right. And you said that there was some dark force. You're not talking about the room was dark. You felt some sort of
Yeah, it was like the
dark
devil was
energy.
behind me. We were the light coming in, and there was the devil behind me. It's what it was. It was dark. It was the devil.
And then you saw Maya in the Easter of 2020. You recall seeing her then?
That was during COVID, if I may ask the question. It's
Um,
all those years sort of.
Yes, I'm just going by your deposition testimony you previously said. Do
Can you
recall seeing her
refresh
at
my
Easter?
memory?
Do you recall
I
seeing
do.
her at Easter?
Yes.
Okay. And your description was that she was walking like a beautiful, thriving young teenager when you saw her, correct?
Yes.
Thank you.
You're welcome.
Mr. Whitney?
Did any of the nurses that entered the room tell you to go downstairs to get a badge? You missed the security desk or something like that?
No, sir.
Did any of them mention to you that these DCF background checks were being done on supervisors, but not just plain visitors?
No, sir.
Were you there as a spy, or were you there to give Maya hope?
I was there to give Maya hope.
Overruled.
Were you there as a spy,
No,
or you were
sir.
there to give Maya hope?
I was there to give Maya hope.
Nothing further, thank you.
Ms. Crowell, anything further?
No.
Members of the jury, do any of you have a question? Attorneys, please come forward. Ms. Brown,
Yes.
question from the jury is, did the Dark Force people say they could not pray with Maya?
Yes.
Any follow-up, Mr. Whitney?
No, Your Honor.
Ms. Crowells?
Yes. Ma'am, isn't it that you were there for a few seconds, they came in and they told you that you had to leave, that you could not be there, correct?
Joyce was explaining to them that we were there to pray, and they said we could not do that.
They said you could not stay, correct?
We could not pray or stay.
Thank you.
Members of the jury, are there any other questions? May this witness be excused?
Yes, Your Honor.
Oh, that's right.
Hey, Ms. Brown, you're free to go. Thank you.
Thank you.
Okay, members of the jury, I'm going to go ahead and let you go for lunch here in a couple of moments. And Debbie Coley, I'm going to want them back, ready to go. Let's call it at 1:30, so it's a little bit shorter than an hour and a half today, okay? Do not discuss this case amongst yourselves. Do not do any investigation and receive no information. Okay? You're free to go have a good lunch. Okay, the jury is out of our presence. Everyone feel free to sit. Are there any issues we need to